everybody. I'm Angela Hart, and welcome to the show. I'm glad to tell you that we're producing a series of television shows that are focusing on caring for seniors, whether it be nursing homes, home health care, rehabs. Many of us are facing the issues of dealing with aging parents. And so I've invited a panel to join me today to introduce you to ideas and help you understand how to work through the maze of caring for seniors. And I'm honored and I'm privileged to have guests from Centers Healthcare, which is a not-for-profit post-acute organization. And Centers owns 30 skilled nursing and rehab facilities, home health care companies, adult daycare centers, assisted living, renal dialysis centers, urgent care walk-ins, and they also serve as a Medicare and Medicaid managed care company. These people know about caring for seniors. And so it's my privilege I'll start on my left. I'd like to introduce Ann Cheng. She's a VP of Clinical Operations for a home healthcare network. Welcome, Ann. It's so good to have you on the show.
Thank you. Thank you so much for having me. It's a pleasure being here.
Great. We're going to look forward to picking your brain a little bit in a little while, all about things that can help caregivers take care of their family members. And my co-host is Ellie Goldbaum.
How are you, Angela?
We're doing great.
Thanks again for having me back.
Yeah, Ellie is an expert in nursing homes because he manages nursing homes and he works closely with home health care agencies. He also has counseled thousands of caregivers on the financial aspect of taking care of their loved ones, whether it be getting onto Medicaid or dealing with the health insurance claims. He deals with those kinds of things. And he's also a Medicaid enrollment and eligibility expert for over how many years?
It's close to 30, believe it or
Now,
not.
we know you've been at it for quite a while. Thank you. Thank you for joining us. And we also have Dr. Marco Michelson, Chief Medical Officer at one of the MLTCs right here on Staten Island. So many of the Staten Island viewers may be familiar with you. Welcome, Doctor.
Thank you. Pleasure to be here.
Thank you for joining us. How long have you been out here on Staten Island?
Well, I've been on Staten Island since 2014.
14, so
Yeah.
you must know a lot of the families here.
Yes, we're getting to know quite a bit of families here.
Well, that's very good, and we're so glad you're here.
Thank
So
you.
where should we begin?
I think we should begin this time. You alluded to the fact we said MLTC. I think a lot of viewers have no idea what an MLTC is. And I think it's important that maybe Dr. Michelson fills us in, or I'll help him fill us in on what an MLTC actually is.
Great.
I think the first thing to understand, the acronym actually stands for Managed Long-Term Care. And what that is a Medicaid product that if a person has their Medicaid, and I guess we'll speak about it more in depth, the concept of the reimbursement to the providers comes through the MLTC, sort of like an HMO, for lack of a better term, where they control and take care of the patient's needs and care. And I'll turn it over to Dr.
Okay.
Michelson to fill us in a little more.
Thank you, Ellie. So, yes, as you alluded to, MLTC is a managed long-term care plan. So, managed long-term care plans are unique in that they're designed to assist individuals to remain in the community for as long as possible, basically in the least restrictive setting possible. So, in order to accomplish this, what we do is we coordinate care through a variety of different settings: home care, long-term care, rehab care, as examples of these kinds of settings when a person is transitioning from different healthcare settings, home care, for example, or nursing home care or hospital care, or back into the community.
Wow. So the seniors are getting sort of, they're under this umbrella of care.
Exactly.
With the managed long-term care companies, and some are for profit, some are for nonprofit. But the point is that they're overseeing the direction of care for our seniors. Correct?
Correct. That's what I think that the confusing part to the average person is how do they actually end up getting onto a managed care plan?
Yes.
Why they particularly would choose? I believe there's about 23 plans
Yes,
currently
yes.
in the state and in the city. So they have 23 different plans, and me as a consumer, if I was given a list of plans to choose from, how would I know where to go with that?
Well, it's a good question because consumers are faced with this almost every single day. And one of the unique features of managed care in New York City is something that happened almost a year ago now, which is this transition from into managed care for people who are living in long-term care facilities. And this may seem scary for a lot of people who are living in long-term care facilities.
When you say long-term care facilities, I
Yes.
think we should just explain to the viewers that long-term meaning a skilled nursing facility.
Yes,
I think
exactly.
That's what you're alluding to.
Exactly. So what exactly happened in 2015? What happened is the government, in the course of trying to streamline Medicaid managed care, created these new sets of rules, which then caused people who were in long-term care settings, particularly for permanent stays, basically their homes, to transition into a managed care environment. And since that time, more and more people have transitioned to managed care. So the good news is that for a person that was already living in a long-term care facility, nothing really has to change. They can remain exactly where they are. But the difference is that a managed care plan now has become involved in their care while they are living in a long-term care facility, and in effect becomes their partner in facilitating the transition of care that may occur if they are moving to the community, or to continue working with the facility staff to make sure that care is appropriately coordinated.
Okay.
Excellent.
So I think that, having been involved in the industry and understand a little of the industry, I think we could talk to Ann for a moment of, try to understand a little of, first of all, I understand you work for a certified home health agency?
Yes, I do.
Yeah, okay, so I don't think the average viewer even knows what a certified home health agency
Yes.
is and why I would need one, and maybe if you could explain sort of
Sure.
how that fits into the MLTC piece.
Sure. Well, we are a certified home health agency, and what we basically do is provide skilled services to patients in their home. When I use the term skilled services, what I'm referring to are nurses, physical therapists, occupational therapists, social workers, nutritionists, home health aides. And what we basically do is we look at the patients individually. We engage the families in realistic goal setting, and then we really view ourselves as patient advocates as well as partners in care. So when we speak about the MLTCs, we view ourselves as a partner of theirs in the long-range goal of really having that patient achieve the highest level of functioning possible and stay in the least restrictive environment.
So I think as a viewer, I'm listening to all of what you're saying, and I think you're being a little technical. So I'm going to break it back down to, I think that's for the actual viewer to understand where we're coming from. So the way I like to try to set this up for the viewer to really understand this is someone who has a parent who all of a sudden ends up in a nursing home setting or in a hospital setting, and this is all new to them. So all of a sudden we're saying, CHA, MLTC, nursing home, I don't even know what you're talking about. It's a bunch of alphabet soup to me. So, we try to break it down, and I guess maybe we could work together to try to explain to the viewer how this particular person would come out of the nursing home or the hospital, and as we're speaking about the idea of transitioning into care, so what does that mean to the average viewer of transitioning into care? Why would I choose your agency as opposed to a different agency? Why would I choose your plan as opposed to one of the other 23 plans? What is the benefit to anybody? And, I think we have to just step back.
Sure.
If I may intercede, in general terms,
Correct.
what would a consumer look for when they're looking for an agency to choose one? What would be the general observations they should, or research they should do?
Well, I think that firstly, you want to make sure that you're partnering with an agency that has a good track record. You want somebody who has positive patient outcomes. You want somebody who really has individualized programs that can meet the needs of your family member. And I think the home health agencies in general basically strive to achieve that. How we do that is we like to sit down, we speak to the patients, we speak with their families, we try to understand what their individual needs are, and then from there, we come together as a group and we collaborate to really try to come up with a plan to get you from point A to point B. Now, in doing that, you had just said, how would you choose my agency over somebody else's? I think the choice is very simple. When you are a consumer, you're out there in the marketplace, you're looking at various options, you're looking at different choices that you can make, and I think a part of that choice is looking at the track records that people have. And when we speak about track records, we have to look at the outcomes of the patients and how the agency has really been able to impact those.
Yeah, I think one of the other things, and maybe, you actually feel free to jump in any time. One of the things that I think is a little confusing, I see, as everyone else does, advertisements up. People are just advertising every day, home care agencies. I, as a professional, understand the difference between the types of agencies, but my understanding is most of these agencies that are actually advertising, well, a lot of them are licensed home care agencies, and I think maybe you could explain a little to the
Sure.
viewers.
You mean there's some that are not licensed?
there, as opposed to a certified home health agency. So,
See,
yes,
learning
as
something
I
new
said,
every
the
day.
alphabet, so we have what's called a CHA, which is a certified home health agency, and a license is called a LICSA, which is a licensed home care agency. So,
Oh, tell us the difference.
Yeah.
Tell the viewers.
Sure. So, as a certified home health agency, what we do is we provide the skilled services. So we provide the nurses, we provide the therapists, and we also work very closely with the licensed agencies. The licensed agencies provide the personal care patients need. They provide them with the everyday activities of daily living assistance, and they do it under the direction of the certified agency. So basically what we do is, after we engage the families, after we engage the patients, and we develop that plan of care, what we then do is we then direct the licensed agency on what appropriate care is to be provided for the patient, and we oversee to ensure that it's being delivered.
Oh, that gives me a lot of comfort. So the aides who come to the home who help the elderly with activities of daily living have been instructed by the certified ones. Did I
Yes.
get that right?
that's correct.
That's good. That's very
And
encouraging.
also, our staff will go out and will supervise the unlicensed staff on a regular routine basis to ensure that the care is being provided appropriately and within the best optimal standards that that patient can have.
Typically, your patients come from the nursing homes, from the hospitals.
Oh, we get patients from a variety of different referral sources. They can be the hospitals, they can be the nursing homes. Physicians can refer directly to us. We get patients from all over. And what we really try to do is we look at the individual, we look at the different places from where they're coming from, and we really try to zone in on how we can make the experience individualized and personal for that person, and for that person to have the best outcome possible.
Right, so, I mean, I'm just, now we're gonna, I guess, flip over, Angela, to.
Yeah,
them.
this is
I
very
think- I think-
helpful,
I
very
think part of the
interesting.
problem is that the people in the community don't really understand. So very nice, the person came out of the hospital, and now we, again, we're trying to make this
What happens next?
Really, what
Right.
happens next. So I think initially a patient comes out of a hospital, will go into a certified home health agency.
Who the
We-
hospital refers them to usually, right?
Yes.
The hospital will typically refer the patient or out of the skilled nursing facility as well. After they finish their short-term rehab, they need to go into community, and that's what we're discussing, the idea of transitioning. That's the transition. They're going from one level of care to a different level of care, and we have to make that smoothly. Am I right?
So absolutely. So let's talk about transitions, because in some respects, not only are they the most scary situation for a potential member or patient, but they're the most highest risk situation, because here you have a person who's potentially in a nursing home who might be trying to go into the community. But as we've already discussed, there may not be a lot of information about how to best effectuate that. Alternatively, the person could be in a hospital, and they might want to be transitioned back to the community, but they may not be ready. So work may be getting done to move them to a nursing facility. There might be situations where a member is at home, and the member and the family are fearful about going home because of the significant burden that going home places on the member and their family, and the concern that constantly exists about whether or not they're going to be able to manage at home. So how do we mitigate those concerns? Well, one of the ways of doing that is to make sure that there's an appropriate assessment of physical needs, making sure that maybe a personal care aide could be made available to that person to go into the home, support them, and where possible, make sure that they're safe in the home. And that really is the MO of the managed long-term care industry. There may come a time when, in fact, it may be difficult to retain that person in a home, and then other considerations need to be made, specifically moving into a nursing home, for example. But there again, who is going to coordinate that transition? Because you've got a lot of pieces that are in play. What ends up happening is that the person needs to disconnect with the care that they currently have with a lot of the providers that they have, and the family then is left wanting in terms of individuals that they can connect with to really coordinate that whole care process.
So if they're disconnected, how can they get connected?
Well, that's where the Managed Long-Term Care Network comes in. Because not only do we have great agencies like ANS, but we have a lot of other agencies that deal with other components of the person's physical needs that we can bring into play, bring it to bear to put those services into place.
So is this the actual case manager that oversees all these different?
Yes.
And
yes.
the case manager works for whom, usually?
There are many agencies that have their own care managers. We have ours. And one of the ways that the MLTC industry tries to effectuate a well-coordinated plan of care is to work with all of the individual agencies' staff to make that happen. Nursing facilities have a full interdisciplinary care team that really looks at the care plan while the person is in that facility. But the care plan that really needs to be created is one that's unified, so that we want to make sure that nothing is dropped, when a person moves from a facility setting into the community setting.
I found it interesting that you said that you deal with the nutritional needs
Yes.
of the patient. How is that?
Well, basically, after we go out and we do our patient assessments, we would look at, what the care needs for that patient may be. And some of them may involve nutrition. What we do is we send out certified diabetic nutritionists as well as on a consultant basis and routinely. And what they do is they work with the family on how best to optimize that patient's nutritional intake so that they can promote the best healing possible for their situation. What I like about that is that everything is done with the patient through patient engagement. We need to involve them. They need to be part of the plan. They have to be part of the goals. And together, as a unified front, we work to achieve the best outcomes for them.
Excellent, excellent.
Who pays for those services?
Nutritional?
Oh.
Well, that would depend. And not to get too technical, but it would depend on what payer source we're looking at. So in certain situations, it may be under the patient's primary insurer, which in most situations would be Medicare. In other situations, it could be an organization such as Dr. Michelson's, who is providing direct authorizations to us to be able to provide the wonderful services to the patients that they need.
So it really depends on each individual situation.
Yes.
Yeah.
I understand that the managed long-term care agencies are really focused on keeping patients out of the hospital these days and keep as well as they can be healthy in doing so, and to help prevent them from being readmitted. What kind of procedures are in place for this, and how does it work with plugging into the right community groups?
So that's key, and I just want to emphasize that, again, the managed long-term care's mission is really to try to keep the person in the home. These are people who in the past may have otherwise qualified to go into a nursing home, but because of the new services that are available through managed long-term care, are able to remain safely in their home as long as possible. So part and parcel of all of this really is, certainly there is a point where a person's care may become so complex and so needy of a certain level of care that really can't be provided at home any longer, that a hospitalization may be necessary. But again, one of the things we'd like to do in advance of that hospitalization is to identify certain things that might be causing the person to be at risk for deteriorating to the point where they may need to be admitted. And conversely, when a person has finished their hospital stay, to try to work with that person if they want to return to the community, to make sure that they have all the services in place to support them in
What
a
do you
community.
mean that there could be things that are helping them or causing them to deteriorate? What do you mean?
So we spoke of had physical rehab needs before, or physical therapy, for example, or support services like personal care aides. Well, you can imagine a circumstance where if a person is at home and they're not getting sufficient supervision in terms of maybe taking their medications, or maybe their physical situation is such where they can't walk around the apartment safely. That places them at risk for falls. If a person falls, in the worst case scenario, that person could then have a very serious injury that results in their being hospitalized. And if it's serious enough, it might require surgery. And then it sets up a whole different cycle of care
Yeah.
where they then have to go to a nursing facility for probably rehab care. Ultimately, this person may want to return home. But you see a very simple intervention, such as providing a little bit more support in the home, making sure that the environment of the home is safe, making sure that they have all of the supports that are necessary, maybe even sufficient physical therapy, may have prevented that very fall that caused a very significant change in a person's overall health status.
So, thank you. One of the things
Yeah.
we learned about recently on one of the shows is it called CCAP or CDAP?
CDPAS.
CDPAS.
Can we speak? Can one of you
CDPAS.
speak to that about
Sure.
what that is, so we can educate the viewers who hadn't seen the other
What
show? about
CDPAS stands for is Consumer Directed Personal Assistance Services. So you have situations in the home where a member may not feel comfortable having, let's say, a personal care aide from an agency come and take care of them. But they may have family members, and this particularly applies to children, where the children is willing and has the time to take on responsibilities for managing that person's support. And this comes into play very often in situations like diabetes, where a person may need help administering insulin. Well, a personal care aide is really not allowed to do that. But a person who is related to that member, who learns how to administer insulin, could be engaged to do this very kind of work.
And be paid for it, I'm told.
Exactly. So now you have a situation where the member now has literally engaged a relative, perhaps, typically a daughter or a son, or a close, trusted friend, to come in and support this person's care in a way that could not previously be possible.
So viewers, did you hear this? If you have a neighbor or a relative or a close friend that maybe has a good relationship with your loved one who's older and needs a person to assist them with certain things, they can register, I suppose, with one of these agencies and be actually paid to take care of them. They're taking care of them anyway. They might as well get paid to do it. And the senior person feels more comfortable with them.
Right. I mean, there are certain requirements that the person has to be able to, in a way, direct their care. It's a very unique process because really that person, the member, or the designated representative, is in effect the employer. So they have total control over the quality of work that's being done, whether the person remains employed in that particular capacity in that person's home.
Did you want to share anything about that? Is that something you're involved with?
Well, we are. A lot of the times as we are setting patients up and we're providing the care to them, we really have to assess their long-range care needs. And in certain situations, it doesn't stop after the skilled services end. They require those long-term services. So a lot of the times when we're dealing with the families and we develop those relationships, we understand that the children may be involved, such as Dr. Michelson said, and they feel that they can best be suited to care for their family members. And we would help facilitate that process as part of our discharge plans.
So how can a neighbor or friend that has a good relationship with someone who's homebound now and needs these services, how can they register to become an official?
Well, this is one of the advantages of having a managed care plan as a partner, because that can be something
So the person
facilitated
has to be
through
on
the managed
Medicaid,
care plan.
the patient, and the aide or the proposed aide has to call their MLTC organization.
Basically, what you have, Angela, is you have all these services that if someone requires these type of services on a long-term basis, they would try to get their Medicaid under, in other words, they have Medicaid, but they would try to convert it onto an MLTC or a plan that would cover the services that they require. Now, once they're eligible and they actually join the MLTC services, there's a process to go through, an eligibility process to get eligible for an MLTC, and once they assess the patient and they join the MLTC, so now the MLTC is responsible for the care of all these different disciplines. They're responsible for the care. At that point, and I think that's what Dr. Michelson was alluding to, at that point, any of the services that they would be required to have would come through the oversight of that MLTC.
But did you answer my question? How does a neighbor or friend who wants to become that person to help them join up with, enroll into this,
So
to
what
help
ends,
them
so what ends up
officially?
happening is that they would actually work through what's called a license agency. That would be the licensed home care agency that they would work through, where the license agency would be contracted with an MLTC, and the MLTC would be able to pay the license agency, who in turn pays this, the loved one to take care of the patient.
Okay, so I'm a viewer, and I'm watching this, and my neighbor across the street has just been discharged, and she's getting care, and I would like to be the person to be paid as a neighbor to take care of them.
Yes.
And so I would ask this neighbor or her caregiver, what is the name of your managed long-term
Yes,
care
yes,
contact?
right.
Or
Exactly.
care manager, who is the who should they call? Because I'm thinking people are watching this and thinking, oh, I want to do this for my loved
Yes.
one or my neighbor. What do they do? What is the first thing they should do?
Another advantage of being as part of a managed care plan is that you have an advocate. I mean, you have a care manager that really is overseeing the entirety of your care plan spectrum. So that is that one person that you would reach out to assist you.
Good.
If a member is saying, look, I have a friend, I'd like to engage in this particular process, that care manager would assist you.
That's the answer I'm looking for.
in-
So the
in
care manager
working
is-
through that
okay,
process,
great.
because it is complicated.
Yeah,
And
yeah.
we wouldn't expect the member to do that all on their own.
Yes.
But there are multiple aspects of this process that would have to be coordinated.
CDPAS, and it stands for?
Consumer-directed personal assistance services.
Excellent.
Okay.
Excellent. Okay, so I'm going to touch on something that wasn't in the script that we didn't plan to speak about. there's the issue of, while we're trying to keep seniors home more in their own environment and where they're usually more comfortable, happy, and familiar, they're also more isolated. And I realize that the aides are there to assist them with activities of daily living, but they're not always the best companions, and nor should they be. Do you have any plans in the future to incorporate some kind of companionship roles to get the seniors out?
That's
or get
a
them-
good question. Right now, companionship per se is not a benefit that's provided. However,
It should be. I
could be.
We'll call the governor.
However, there is something that's similar to this, where members who in fact are alone in the home and are suffering from lack of socialization,
Yeah, it's awful. It's depressing.
in effect can be helped by, again, another component of the managed long-term care plan, which is a social adult day center.
A social adult aid center.
Adult day.
Social adult day
Day
center.
center.
Okay.
So the social adult day center is, in a sense, less of a medical service than it is really an environment where a person could become socialized. They could interact with other individuals. They could have some basic supportive needs met, but primarily it's designed to keep that person engaged. And this becomes very significant in people, again, who, as we mentioned, who are living alone.
So the way
Yeah.
that the caregiver can plug their loved one into this is through the care manager again at
Yes,
the MLTC.
exactly.
This is great information. This is great information. We have about a minute left or so. Would you like to share any closing comments?
So I'd be a little bit remiss if we didn't speak a little bit about the flu. And many of your viewers may not know, but the Centers for Disease Control has designated December 4th to December 8th as National Influenza Vaccination Week.
Oh, great.
That does not mean that you can only get vaccinations this week. The flu season, as you probably know, runs from anywhere between October to May, June of the following year. So we want to make sure that all of your viewers really are aware of influenza, make an effort to get vaccinated, protect yourselves, protect your loved ones. People don't realize that 90% of influenza-related deaths, as well as 60% or over of influenza-related hospitalizations, occur in people over the age of 65. So this is a prime opportunity to really make sure that a very simple vaccine that's available is taken advantage of to protect yourselves.
Pardon my ignorance. What is the difference between influenza and a flu?
Same
Same
thing.
thing.
Oh, this is okay. Other
thing.
viewers might be wondering. Did you have
Yeah.
anything you wanted to close?
I just want to thank you for having me, and it's been a pleasure.
Thank you. It's been very informative. Ellie, anything else you want
No,
to
I
share?
think we really touched on a lot of very important
Yeah.
topics, and this series is really so important. I mean, as someone who constantly meets with people in the community, people come to us with these questions all the time, and they're just lost. It's so important to just give the people in the community some idea of really how to, as you said before, this is a maze of healthcare. How do you navigate this maze? And you have to try to really, have people on the show like this who could help people navigate the different. I'm sure many of the viewers, these topics touch their heart because they've dealt with them. And if they didn't deal with them yet,
They're
gonna-
about to.
They're about to, exactly.
So thank you again, and we hope that this has been helpful. And viewers, we're on Staten Island. Every Tuesday night, you can view us on Channel 34 at 8 p.m. We're also airing in Brooklyn and Manhattan. Stay tuned, and we hope to see you again. Thank you.
Thank you.
Bye-bye.